Hello and welcome everyone. Thank you for joining today's presentation from the Health Connector, where we will present an overview of the Health Connector and resources available for those in need of health insurance coverage. You have joined the webinar, Health Insurance Options and Savings through the Health Connector. We have a number of participants who have signed up, but we will get started at noontime today as scheduled. I'm Erin Ryan from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues, Nikki Conti and Melissa Montrand, who will be presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A functionality. We will be monitoring your questions throughout. Please do not disclose any personal information or protected health information when you ask your question, as others on the call are able to see what you've written. If you have a particular personal scenario that you want to discuss with someone, we'll be providing contact information for the Health Connector's Customer Service Center and instructions on how to find help from a local navigator. We are recording today's session, so following today, you'll receive an email with the presentation, so there's no need to take detailed notes. And so, without any further ado, let's get started.
As you can see from our opening slide, we are talking about health insurance options and saving through the Health Connector. So we'll spend time talking about our organization and how you can get coverage for individuals and families through mahealthconnector.org. So the 4 topics we'll go over. For those of you who don't have familiarity, we'll talk about the Health Connector, get into some specifics about getting individual and family coverage, as well as where you can get help with this process if this is your first time, and key takeaways and helpful resources. So Erin mentioned this, but I just wanted to reiterate, I'll be covering part of the presentation, and then my colleague Melissa Montrand will be co-presenting with me. And so we hope together to be able to give you all the information you came here to get today. So let's start with the Health Connector and who we are. So we are the state's health insurance marketplace, and we offer coverage for individuals, families, small employers. Basically, we're here to provide access to individuals, families, and small businesses who may need health insurance coverage. Really for people who don't have health insurance through a job, they're a spouse, a partner. A lot of people who apply actually get help paying for their coverage. And, we're really proud to be able to, share all of this and that this is available to consumers in Massachusetts. It is important to note that people can buy dental insurance through the Health Connector. And it also is important to note that when we talk about small employers, we're talking about those employer groups that have 50 or fewer employees. We won't get into too much depth about Health Connector for Business in today's presentation, but do know we offer a quarterly webinar about Health Connector for Business. So if you are interested and want some more information about Health Connector for Business, you can sign up through Eventbrite. And I believe we have another session either in September or October. So certainly take a look there if you're interested in that. So on this slide here, I'd like to just give you a quick overview of Health Connector plans and just kind of orient you to some health insurance speak or maybe our health insurance landscape. Really important for you to note is that all the plans that are sold through the Health Connector meet state and federal standards. So you do not need to worry about this coverage. So in particular, if you've been living in Massachusetts for a while, you know that if your plan doesn't meet certain standards, you could in fact be penalized for not having a comprehensive plan. So Health Connector plans meet all state and federal standards, so you know you're getting that coverage. In fact, they're all known as qualified health and qualified dental plans. So from your perspective, what that means is you know that you can choose from a variety of qualified plans in your area from the leading insurance companies in Massachusetts. Specifically available through the Health Connector, because we are the state's health insurance marketplace, people can qualify for advanced premium tax credits. So what these tax credits do is they reduce the cost of monthly premiums. And then unique to Massachusetts, we have connector care plans. Now, people who are in lower income brackets who meet other eligibility requirements might qualify for these low or no cost health insurance plans. And in further slides, I'll talk about these plans a little bit more. We'll look at some benefits, we'll look at some potential premiums, etc. It is also important to note that we do sell catastrophic plans. So catastrophic plans have some limitations. They're available to people who are under 30 years of age or with the hardship exemption. What I do like to tell people about catastrophic plans is that sometimes as you're looking through the plans, and if you're eligible to buy a catastrophic plan, it may seem very appealing to buy this coverage because the premiums are lower. However, I just want to point out that there are higher costs at point of service. So when you go to pick up a prescription or you go to get a service. So just that is my own, buyer beware or background on catastrophic plans. Now, dental coverage, when we're thinking about someone's overall health, it is also really important to think about dental plans. We do offer dental plans for individuals, children, families, small employers. And as you can see, we have pediatric only plans or plans with lower or higher deductibles. And as I had previously mentioned, we do have a set of plans and a process for small businesses to buy health insurance coverage for themselves, the owners for themselves and their employees. This is known as Health Connector for Business, and there are different plan structures there, as well as different opportunities for savings. So again, if you're interested in Health Connector for Business, definitely do sign up for one of those webinars where it will be covered in much more detail. On this slide here, I just want to bring your attention to the American Rescue Plan. I had previously mentioned that coming to the Health Connector and buying coverage through us, people are able to get access to advanced premium tax credits. There's a relationship here with the American Rescue Plan. So this was signed into federal law in March of 2021. And this law helped make financial help with health insurance available to more people. So most people who already got help paying for insurance through the connector may now save even more. And people who didn't qualify for help because of the American Rescue Plan got to see a lot of lower monthly premiums. So these savings are currently in effect through the end of this calendar year. So we certainly do, if you're someone who's looking for coverage right now, we certainly do want you to be aware that these savings are still available. So please do take advantage of them while you can. Also on this slide is a link to a preview tool. So before you complete a full application, you can go to this Get an Estimate tool on our website, enter some very basic information about you, your household, and you can see what plans are available to you. So my colleague Melissa is actually going to give us a demo of that website and that tool as we move further on in the slides. So with that, I am going to hand this over to my colleague Melissa, and I will wait for you to join.
Hi, Nikki. Thank you. And good afternoon, everyone. So I'm just going to go over the overview of the Massachusetts Health Connector. So who can apply? So there are 3 ways in which you can apply. But first, you should apply if you live in Massachusetts, you are a US citizen, US national, or are otherwise lawfully present in the US, and you don't have health insurance. You should not apply if you are enrolled in Medicare, Mass Health, or Medicaid, or other public health coverage, are offered affordable, comprehensive health insurance from an employer, or if you are in jail. So when can you enroll? So if you have a qualifying life event, you can enroll in or change health insurance plans outside the annual open enrollment period. Life events that let you qualify may include changes in household makeup, income, immigration status, or address, certain other life changes like getting married, having a baby, or losing job-based health insurance. Report any qualifying event within 30 days of it occurring. You have 60 days from the date of the qualifying event to select a new plan. Payment and enrollment deadlines still apply during a special enrollment period. So applying for coverage. So there are 3 ways that you can apply for coverage. The first way is online at mahealthconnector.org. We also have a Spanish version, which is the mahealthconnector.org/ES/. The second way is by phone, and the third way is with the help of a partner community organization or health center. There is one application to find out if you qualify for coverage through Health Connector, including help paying for coverage or for coverage through Mass Health or Medicaid. You will get letters from the Health Connector and Mass Health that will tell you your next steps. So what do you need to apply? So you will need Social Security numbers for everyone applying if they have one, immigration documents for all non-US citizens who are applying if they have one, and you can learn about those documents in the immigration documents link. Recent pay information if you have it, such as copies of your last 2 pay stubs, your unemployment amount, which is the monetary determination if you are collecting unemployment, any other information about your current income. If you don't have all the information above, just give us what you have and we'll send a letter asking for more information if we need it. So the application for individuals and families. So here's a quick example of what the cover page looks like. So again, to go to this page, you just want to go to mahealthconnector.org. And also keep in mind that we have the Spanish version, which is the mahealthconnector.org/ES/. So we only have one application for the Health Connector, Help Paying, and Mass Health. So basically here, this example, we have 2 things circled. So on the top, we have the sign in. So basically, if you already have an account with us, you will want to put in your email, login, and your password. But if you don't have an account with us, you just want to create one. How do you enter income? So when you complete an application, you'll be asked about your current income and your estimated income for the year. You want to enter your current income as it is now, your job, including unemployment income. Then you enter your expected yearly income based on what you think you'll make over the course of the year. When entering your yearly income, you want to consider how much you earned so far this year. You want to add any unemployment, and you want to think if you will be returning to work later this year, also include what might be earned. If your income changes later, you update your income information so it is as correct as possible. Keep your income and application up to date. Remember to update your income if your employment situation changes. Keeping your income information as accurate as possible helps make sure you get the right amount of help paying for health and dental insurance. You have a lower risk of owing money to the IRS when you file taxes next year. If you get advanced premium tax credit, which is the APTC, you can always adjust the amount you take by clicking on the Change Tax Credit link from the Find a Health Plan page of your application. Be sure to send in any documents you owe in the required 90-day time frame to avoid issues. So now I'm going to give it back to Nikki.
Thanks, Melissa. So Melissa just went through a lot of details about when can you apply, what you need to apply, even, you know, exactly our websites, and that the application is available in English as well as in Spanish. Now, I want to get a little bit, or give you a little bit more explanation about how you can get help paying. So we've mentioned a couple of times advanced premium tax credits, and we've also mentioned the Connector Care program. So really important on this slide is to acknowledge that there are two kinds of help. There are two kinds of help paying that you can get when you are getting coverage through the Health Connector. So you can get these advanced premium tax credits. They lower the premium amount you pay each month. The IRS is going to send that tax credit directly to the insurance company. The money does not come to you, but basically you get to pay less each month. Now, when you're going through the application process, you get determined eligible for a certain amount of tax credit. Since this is about you, you get to choose, do I want to apply some or all of that tax credit to my monthly premium payment? Now, as Melissa was talking about, like, it's really important that you keep your information up to date so that essentially you're getting the right tax credit amount. And again, when you reconcile your taxes or you file your taxes the next year, you're going to take this information that's going to be included as part of your tax filing process. Now, we also have the Connector Care program. Now, the Connector Care program, as I mentioned before, it has lower costs. Some people could qualify for a $0 plan or a monthly premium that's fairly low. The way we do that is we use federal advanced premium tax credits plus additional state dollars. Those two together help reduce the amount that you as the consumer will pay each month. So these plans, the Connector Care program has plans, very comprehensive health insurance plans with low monthly premium, low out-of-pocket costs, and there are no deductibles if you qualify for Connector Care. So as you can see here, depending on what you qualify for, you might be able to choose a plan for $0 or even as low as $134 a month. Now, you might be wondering, okay, this is great. Could I be eligible for some savings? What are the guidelines? So on this slide here, you can see that on the chart, we've listed household size. The next column says Connector Care. So I mentioned the Connector Care program includes both state and federal help. So if, for example, you're a family of two and you're making $51,000 or up to $51,720, you could in fact qualify for a Connector Care plan. Now, before I mentioned the American Rescue Plan, before the American Rescue Plan was passed, we had an income limit for people to receive advanced premium tax credits. Now, because of the American Rescue Plan, that income limit has been removed. So people who with incomes greater than 400, so incomes greater than this chart here, could in fact see that they're eligible for savings. So instead of an income limit, the system determines whether or not someone qualifies for advanced premium tax credits based on health plan affordability. And as we said, the advanced premium tax credits reduce the monthly costs. So what if you're wondering, you're thinking, okay, could I in fact qualify for this? You can use our get an estimate tool and see whether or not you and your family could qualify for these additional tax credits. Now, I want to talk a little bit about, choosing the right plan. So what Melissa covered were all of the things around going through the application, entering all of your information. But once you've entered all of that information into the application, you're gonna know what you qualify for. So the next step you need to take is shopping for that plan. So this might be the first time that you're doing something like this, or maybe you've done it before, but it's been a while. So we have different tools on our website. You can enter provider preferences, medication preferences. You can find plans in your area, look at pricing. So before you apply, you can compare plans based on provider and medication preferences using the plan comparison tool. And I'll do a demo of that later. And then if you wanted to start with pricing and also to see if in fact you could, qualify for some savings, you can use the get an estimate tool. And again, Melissa's going to demo that before we get to questions today. Now, I wanted to show you just a couple of screenshots. So when you're in the online application, you can also enter preferred providers and preferred prescription drugs so that you can compare your plan choices that way. And then when you do that, when you get to your results, your Find a Health Plan page. Now, this is almost like, any of us who are familiar with online shopping, this page is the place that displays all your options. You can see that any preferences you put in are available. They're displaying on the left. You can also sort your results further. You can filter your results further. So if you have done any online shopping, the functionality here is very similar. Now, we mentioned that depending on what you qualify for, you may need to pay a monthly premium. So if you are required to make a payment, I just want to remind you, or tell you, excuse me, I don't think we've told you yet. Payment must be received by the 23rd of the month before your enrollment is considered complete. So you can pay online by clicking the Make a Payment button from this page. Now, also when it comes to payment, we like to share a couple of these details. So payments can only be taken by checking or savings account, but you can sign into your account and make payments, or you can sign in as a guest and make a guest payment. And very recently, we actually started taking payment over the phone with our customer service, or you can still mail in your payment. And again, if you are looking for coverage that begins on the 1st of the following month, you need to choose your plan and make your payment by the 23rd. So getting help, I'm going to actually pass this back to my colleague Melissa to take us to the end.
Awesome. Thank you so much, Nikki. So I just want to go over customer service and community partners. So free enrollment assistance is available through the Health Connector customer service and across Massachusetts through community partner organizations. Our customer service number is 877-MA-ENROLL, and that number is 877-623-6765. And we also have a TTY number, and that number is 877-623-7773 for people who are deaf, hard of hearing, or speech disabled. For information about hours, days of operation, and more, you can go to the Health Connector Customer Service Call Center link. Also, we have community partners that are trained and certified navigators and certified application counselors who speak many languages, can help you from application through enrollment into health insurance plans. They can answer questions about eligibility, the application, payments, plan details, and healthcare reform rules and requirements. It is recommended that you call ahead to schedule an appointment for help. And to find help in your language, you can go to Get Free Help Near You link. So I just want to go over some reminders, key takeaways, and helpful resources. So the Health Connector offers coverage for individuals, families, and small employers in Massachusetts. Individuals and families whose income may have been too high in the past to qualify may now be eligible for Health Connector plans with savings. Always apply for coverage if you need it. You may be found eligible for Mass Health or have a qualifying life event that lets you enroll any time of the year. Losing your employer coverage or losing access to help paying for COBRA are both considered qualifying life events, giving you a special enrollment period for enrolling through the Health Connector. Be sure to apply and compare your options through the Health Connector within 60 days of losing your coverage. You need to apply, enroll, and pay your first premium by the 23rd of the month before your coverage can start. For example, enroll and pay by July 23rd for coverage to start on August 1st. You can also choose to have your coverage start on the second month after you enroll. You can apply for coverage online, by phone, or with the help of an assister through a community partner organization. To report changes, you need to update your online application at any time. You can get free help applying and choosing a plan through the Health Connector's customer service and across Massachusetts through community partner organizations. Call today to make an appointment for help. So before we get into questions, I just want to do a quick demonstration to see ways in which you'll be saving and whether or not you want to apply. So I'm just going to share my screen real quick. And I am on the home page. Just give me 1 second. So from this home page, hopefully everyone can see it.
Yes.
Okay, perfect, thank you. I'm going to hover above Get an Estimate. And from here, you see you have two options. You have the individuals and families, and you also have businesses. So you want to click on individuals and families. Okay. All right, and from this page here is the Get an Estimate. So again, you want to see if you qualify for savings on your monthly health insurance premium through the Health Connector. So this is you just want to scroll down. You choose your coverage year, which is 2022. And then I'm going to enter a zip code here, 02302. So here you want to enter what you think your household income will be for the year. And I'm just going to give an example. I'll just say 65,000. And here you want to put the number of people in household, including people who may not need coverage. So I'm going to put a family of 4. Just scroll down. And then in this part here, you want to enter the age of head of household. And I'll just say 35. And then age of person 2, we'll pretend this is a married couple. So we'll say 32 for this person. And then for person 3 and 4, we'll say that they are their children, 5 and 10. So this is a married couple. They have 2 kids. And on the side of each person here, you have to check off whether this person needs coverage, if this person is pregnant, and if this person is disabled or blind. So I'm just going to say that each person here needs coverage. So I'm going to now go to my results. And on this page, this is just a quick reminder, this isn't an application for health coverage, and that's fine. We're going to continue. So here we have the estimated eligibility for this household. So based on the information I had entered, this household may qualify for the advanced premium tax credit to help lower their monthly health insurance costs. So the maximum tax credit amount is $529, sorry. You are eligible for silver plans with monthly premium as low as $170.02. So if I scroll down, we have it broken down further. So we have the household member, and then we also have their potential eligibility. So for each person now, we're going to see what they are eligible for through the MA Health Connector. So here we have the couple 1 and 2. They may qualify for the Health Connector plans with advanced premium tax credit. And then for 3 and 4, we have the free or low cost coverage through Mass Health. And now we can preview the plans in their area to see what they would qualify for, and also to see how much they would be saving. So this is the estimated savings details. So the Health Connector plan type would be 3A. Their tax household FPL is 245.28%, and their monthly APTC for tax household is again $529, which is the savings every month towards their monthly premium cost. Now we also have broken down even further. We have the carrier, the plan name, the coverage level, the monthly premium, the APTC savings, the MA state savings, and what you pay monthly. So this is a really great tool to see, what carriers are in this couple's area, the type of plan that they would have, how much their monthly premium would cost, and then the APTC savings, and exactly what they're paying per month after their APTC savings and their Massachusetts state savings. So if this couple elected to choose the Boston Medical Center HealthNet plan, they would be saving $529 per month, which means that they would only have to pay $170.02 every month. So this is huge savings for this couple. So then at this page, if you decide to apply, you can click on apply now, and it would take you into our application, and you would basically put in all your information, and it would guide you through the entire process. So this is just a great way to see before you even start exactly what you would be saving and what you would qualify for.
So similar to where Melissa started, we're on the Health Connector's homepage. And so the Get an Estimate tool was under here. Now, if you go to the Help Center and you go to the Resource Download Center, you can scroll down, and we also have another online tool, an online search tool called the Plan Finder tool. So Melissa showed you the savings before you apply, and I want to compare some plans, but this time I'm going to compare plans based on where I live. Based on where I live, the fact that I qualify for Connector Care, and I want to be able to see if particular doctors or a facility or a medication, if those things are available to me with my plan choices. So I've entered a zip. I'm going to, Melissa's people that qualified were Connector Care eligible, and they were plan type 3 members. So I'm going to choose continue. And I'm going to look for my doctor here. Doctor, in this instance, we're just going to go with Dr. Foster. And I'm going to look for a particular health center in this neighborhood. And then I also want to see if a particular medication is available in these coverage plans that are available to me. So what I'm seeing on this page is based on the information I entered, there are 3 health insurance plans available in that neighborhood. They're Always Health Partners, BMC Health Net Plan, and Tufts Health Direct. Of those plans, it looks like there is only one plan that has that medication. My doctor is accepted by all of those carriers, which is great. But if I want to see that doctor at this facility, it looks like I would have to go with the Always Health Partners. So this is, these are kind of real scenarios and questions that people have for us and are going through as they're or making decisions and questions that they have and decisions that they're making as they're going through to see like, okay, so if I want to keep everything the same way, I want to stick with my doctor, stick to where I see him, this particular medication, it looks like I'd have to go this way. But you also, need to think about costs. And as Melissa showed you, you could see the different cost breakdown. So these are certainly conversations that you have with family or other people that can help, like our customer service or navigators, to help you decide which direction you want to go in. Now, before I turn to questions, Melissa, is there anything else you'd want to add in here about the plan comparison tool, or even?
Yeah, if I could just a reminder, or sometimes we're unable to look up certain providers or facilities or prescriptions, and that's okay. What we can do towards the end is call the carrier and we just verify with them whether or not the provider is within their network. So don't worry if you can't find the provider or the facility here. There's always another way to make sure you're within the network.
Awesome. Thanks so much, Melissa.
Sure.
So I think we are ready to go back to questions.
Great. Thank you so much, Nikki and Melissa. This is all so incredibly helpful and so necessary, but it's a lot. So we have some questions that have come in, but of course, for anyone who is watching and as we're going through some questions, if you have more questions that arise, please feel free to use the Q&A functionality or also, the chat box on the side. But to get us started, a question kind of on applying and income and how to handle it. And I think we can kind of take a broad look and a specific, kind of more focused look as well. But what if an individual is, say, unemployed? How should they kind of count their income? What happens if, they're currently receiving maybe unemployment benefits, but they know that's going to end? And I think that question can kind of also be taken more holistically if somebody has more seasonal employment. But how do we approach that uncertainty, and what do we do if you're, say, unemployed or have kind of changing income?
Erin, that's a really great question. When you're going through our online application, you're going to notice that you're asked questions about your current income and then questions about your income for this whole calendar year. So I'm just going to take the case of maybe someone who's unemployed right now. So if you are unemployed right now, you would want to indicate what you are receiving for unemployment income, right? You want to list that as income. But we're also going to need you to estimate, like, let's say you worked a couple of months at the beginning of the calendar year, you're going to need to include that when you're estimating your annual income. Or if, let's say, your unemployment income is going to end soon and you are going back, let's say, to a different type of job, let's say you're a seasonal worker, and let's say, I always like to think about, okay, maybe you're doing some landscaping in the summer, but that, you're going to do some snow plowing in the winter, but there's going to be a period of time where you're unemployed in the fall. We just want to get a general sense of what your annual income is going to be for the whole year. Now, we always say no one has a crystal ball, so you don't know for certain, but you want to try to get as close to an estimate as you possibly can so that you are receiving the correct amount of help, or as much help as you can get for this year. Erin, does that get to?
Yeah, absolutely. And I think just to kind of drive home what we know, both you and Melissa have said, as circumstances change, as you go into a new job, or that those unemployment benefits, might end, update your application so it can kind of reassess the circumstances in real time.
You got it. Because as I said, as Melissa said, if you're getting advanced premium tax credits, again, the key word here is tax credits. You're going to need to reconcile those. You're going to need to file your taxes. So we want to make sure you're not unnecessarily getting penalized when you file your taxes. We want everything to be as accurate as possible.
And to build off of that, Nikki, how do you factor in your household when you're applying? So I have kind of two scenarios. So let's say you're unemployed, but you have a roommate. Do you count their income as part of your household? You live in the same house, and where might that change, or what might the line be where you start to include someone else's income?
Yeah, no, that's a great question, because I think the word household can feel confusing to folks. When you're going through our application, we are most interested in your tax filing household. So that's what the Health Connector, the tax filing household is the information the Health Connector uses to make a determination. Mass Health uses a slightly different calculation for household composition. I won't get into that too deeply, but I think what we like to tell everyone is enter all of the people in the home that you're responsible for. Maybe that's a good way to frame it. You could have a roommate, but that person's income, that's all separate, right? They're not part of your tax filing household, but you could have children in the household that need coverage. If there were children in the household that needed coverage, you'd want to list all those folks. So did I get to that? I hope I was trying to kind of delineate a little bit. So I think the clearest answer is think of who are the people who are on your tax forms and enter information for them. Another point there is, let's just say you have a dependent, but for whatever reason that dependent has coverage, they don't need coverage. You still want to include that dependent, but just click the box that says this person does not need coverage.
Great. No, that's super helpful. And again, thinking about it from a tax filing standpoint. So if it's, just a friend that you're living with and you really don't have involvement with one another's finances, leave them out of it. When we are talking about, reporting unemployment or income, is this something that should be reported pre-tax or post-tax, or how does somebody take that into consideration?
So we're looking at modified adjusted gross income. So I think the easiest way for me to think about it is what is the amount you're making pre-tax? Maybe that's just what is the if your salary is $52,000 for this company and you're earning that for that year, we need to know about that. And then there are certain deductions that are taken into consideration. But that's something that as you're going through the application, they'll ask you very specific questions. Now, for those of you who are self-employed, you want to look at, actually, let me come back to that. But just know that, let's say you are a sole proprietor or you're self-employed, you're starting a business, you would want to get your coverage through this application to see if you could qualify for some help. And I just want to look up on this side, I just want to look at the name of the tax document that you want to look for if you're self-employed, but let us know if anyone's in that situation. And if not, I'll include it in the email.
Great, thank you, Nikki. So essentially you're saying, so for the example you shared earlier with respect to unemployment specifically, say you worked January to March, you take what you earned through employment, your job for those 3 months, pre-tax essentially, and then you include your unemployment benefits pre-tax, and you kind of carry forward with your best kind of guess and update as frequently as you can or needed.
Yes, yeah. So that's a really great point. I think depending on how you like to do things, truthfully, I think the easiest thing to do is just to make a quick list, write out January through December, estimate what you made those months, estimate what you're making for unemployment the other months, etc., and then just add that up and use that as an estimate. Let's say, and as Erin said, if something changes, come back to the application and just make that adjustment. And I think I see that there is a participant that keeps raising, I've seen them raise their hand. So I guess I would just want to ask if you could quickly type your question in. I don't know that we can help anyone who's raised their hand. I don't think we're unmuting. Or can unmute. So if you could type your question into either chat or Q&A, we're happy to help answer any question you might have.
Yep, we are continuing to receive them, so that's great. I'm really glad that these questions are sparking more questions. So we will go through them. You may not hear your question specifically as you wrote it. We try to make them kind of more applicable to the general audience, but do know that we're taking these specific questions and our answers hopefully will not only apply to you, but others as well. So when we're talking about loss of cover, or a qualifying life event, let's say, for an individual who may be voluntarily leaving their work and therefore losing their health insurance coverage, whether they are retiring early or are seeking another opportunity, if it's not say losing your job, I guess losing their health insurance coverage because they are leaving their work. Does it make a difference if you are, say, terminated from your employment, or if you voluntarily leave, or does just losing the health insurance from your employer qualify to open up a special enrollment period?
So I think I just want to get a policy check on this, because from where I stand, if someone for whatever reason has lost access to their coverage, so if they've have been terminated or have been laid off, or chose to leave, I believe that yes, you're just going to tell us what the end date of that coverage is on your application, but I don't want to misstep. So if I know Kayla's on the line, if you wanna.
Sure, hi, thanks, Nikki. Yes, also my understanding, if your coverage is terminated and you lose it, the word doesn't really matter. I don't think there's a specific definition of any of those words that we would be particular about. If you were sort of forced to lose your coverage through your employer, we would call that losing your coverage through your job, and that would open up that special enrollment period.
Great. So whether you choose to leave, you have to leave because of downsizing or whatever it might be, you're losing your access to coverage through your employment, and that opens up a qualifying life event. Great. And so now individuals who maybe are on COBRA and it becomes unaffordable for them, what are their options? Does the fact that it becomes unaffordable, is that a qualifying life event, or is there something else that they should take into consideration or look out for?
So I want to start the COBRA response, and then Kayla, I might need another assist again.
Sure.
But what I want to start off with is that, people come to COBRA a number of different ways we've learned over the last couple of years. So sometimes, you're getting laid off from a position and you're offered COBRA, and I think consumers think, oh, I should take this COBRA coverage because this is what you do. It will let me stay with my current insurance plan. It lets me stay with my current physicians, etc. That is true, but what's important to know about COBRA, and people who are on it know this, you're paying the full cost of whatever that coverage was. So your employer is no longer contributing to that cost. So you're seeing the full monthly premium. We've heard from people that sometimes they go on COBRA and the employer offers to pay for a certain amount for 6 months or 9 months. And then when they're no longer able to pay that amount, the COBRA coverage becomes unaffordable. I know that we had previously opened, basically added a provision where if somebody was in that situation, they would be able to get a qualifying life event because the COBRA is unaffordable to them, because now that employer is no longer able to, is no longer contributing and the cost changed. So I guess, Kayla, I just wanted to see if you could add to that, because I could envision a scenario where someone maybe is or isn't in that situation with their employer, but let's say something else changed and now that COBRA.
Yeah, thank you. So I would say this is a tough one. COBRA can get pretty tricky. My best advice that I can give is that I think folks should think really carefully before they enroll in COBRA. Think about what that full premium might be. Their better option might be to enroll through the Health Connector initially when they lose coverage through their job. And I know that isn't super helpful, but I say that because we've seen temporary rules like during COVID, when COVID first began, that make COBRA a little more affordable, but maybe that rule is temporary and goes away. We've seen that happen time and time again. I wouldn't want somebody to be stuck in COBRA. If you stop paying your COBRA premiums, you may terminate COBRA early, but depending on what temporary rules are in place at the time, you may not be able to get into other coverage because you've already decided to enroll in COBRA. So there's a lot of confusing moving parts in temporary COBRA rules to help people out. But I think the best bet for people is to really sit down, talk to their employer about what the full cost of COBRA looks like, and maybe ask some questions about what it might look like down the line if the employer stops contributing, and then take a look at the Health Connector and just see what other coverage you may be eligible for. I think that's really the best way to go about making that decision.
And can I add one more thing? Aaron, I'm sorry. I almost wonder if you're going to add the same thing.
I think we might, Nikki. You go ahead. Take it away.
Also think about when this is happening. So, for example, if you're getting laid off in August and they're able to give you some dollars. I mean, this would be an ideal situation, right? They're able to contribute money through the end of the calendar year. Know that once we get into an open enrollment period, so let's say you have enrolled in that COBRA, when we get to open enrollment, you can, in fact, apply for coverage and enroll in coverage January 1.
So open enrollment, which runs November 1st to January 23rd, typically, opens that window for individuals who are enrolled in COBRA. And so kind of taking us back now to income counting and household composition. I have two questions. The first would be somebody who might be on long-term disability through their employer.
Yeah.
How do they report that income? If that is kind of their sole income source, is that something that they should count differently, or are there special rules?
If you're getting any type of income, you need to include that as part of your household income.
So I think quickly we can kind of recall our earlier conversation about how to count individuals in your household, but specifically say adult children who might live with an individual, maybe they receive child support for that adult child. How should they be counted? And I don't know if that's different from our conversation, but
No, it's not. I would say if that person is part of your tax filing household, include them. If that adult child is working and has their own coverage and files their own taxes, don't include them. If you're getting child support, include that information. It may be excluded. So it's I'm fairly certain we exclude child support, but if you are the person giving the child support, it doesn't get deducted, if that makes any sense.
yes. And last question, I know we're at 1 o'clock, but for an individual who might be, they know they're losing their coverage in August and they have maybe Medicare that begins in January, can they apply through the connector for that gap period of time?
Absolutely, absolutely, absolutely. And this is where I usually do my plug for, you know, I would try to talk to either a certified application counselor or a navigator to help you with this process. And if you can find one who's also a Shine counselor, that is going to be really helpful to you as you make that transition between having coverage with us or Mass Health and then moving over to Medicare. So if you go to mass.gov and you search for Shine, SHINE, and it's serving the health insurance needs of everyone. This is a program that is run by the Office of Elder Affairs and super helpful folks. You basically just enter or tell them, call a number and tell them where you live, and they can connect you with volunteers in your area.
Great. Well, we are just after 1 o'clock. So Nikki, Melissa, Kayla, thank you so much for all of this helpful information, for answering all of those questions. I might say just before we sign off, you know, there is assistance available. You can contact the call center or also find assistance in your communities. Give them a call. They can help answer follow-up questions that you might have specific to your circumstances. It is complicated and complex, but you know, there are definitely resources out there to help. So you know, definitely go on, use the tools to see if it's something that you are interested in, eligible for, and you know, the Get the Estimate tool is great. So you know, certainly apply if you feel that you need health insurance coverage. You do not have to enroll if you have other options before you, but you know, certainly want to leave you with all with that. So thank you again and take care.